to talk about the cardiovascular system, aka the circulatory system, which includes the heart, blood, and blood vessels, which includes arteries, capillaries, and veins. The heart is a muscular organ. Its muscle type is cardiac muscle. It has 4 chambers, 2 upper atria, they look like pockets here, and 2 lower ventricles, look like these. Veins return blood to the heart, usually oxygen-poor blood. However, the pulmonary veins are an exception to this. They return oxygen-rich blood to the heart. So all veins return blood to the heart. Most return oxygen-poor blood. This is the vena cava, a vein. It has a superior and inferior portion. Arteries carry blood away from the heart, usually oxygen-rich blood. However, the pulmonary arteries are an exception to this. They carry away oxygen-poor blood. So all arteries carry blood away from the heart. Most carry away oxygen-rich blood. This is the aorta. It is the largest artery in the body. Coronary arteries supply the heart muscle. I'm going to talk about blood flow through the heart. To make it more apparent, body is written in blue, and you see the blue portion of this heart diagram signifies oxygen poor blood flow. It's oxygen poor coming back from the body because it's been circulating through the body, the blood's dropped off its oxygen and picked up waste. So blood returns to the heart via the vena cava and enters the right atrium. The right atrium contracts and sends the blood into the right ventricle, which contracts and sends blood out to the lungs via the pulmonary arteries. Now, blood returns to the heart from the lungs via the pulmonary veins and enters into the left atrium. The left atrium contracts and sends the blood into the left ventricle, which contracts and sends blood out to the body via the aorta. We'll talk about blood pressure. Systolic blood pressure is the pressure created when the heart contracts and forces blood into the arteries. Diastolic blood pressure is the pressure that remains in the arteries when the left ventricle is relaxed and refilling. Blood pressure is usually given as systolic over diastolic unless you palpate for blood pressure, in which you will give palp over diastolic. Stroke volume is the amount of blood ejected per contraction. It depends on preload, contractility, and afterload. Preload is how much the heart is filled prior to contraction. The greater the preload, the higher the stroke volume. So think about it. The more blood that is in the heart prior to it contracting, the more blood it can eject per contraction. Contractility is the force of contraction, and afterload is how much pressure the heart has to pump against to force blood out. The greater the afterload, the lower the stroke volume. So if there's a lot of pressure that the heart has to pump against to get the blood out, it's not going to get as much blood out. So therefore, the lower the stroke volume. Blood is made up of plasma, erythrocytes, aka red blood cells, which carry oxygen to tissue and CO2 away from it, leukocytes, aka white blood cells, which are involved in immune functions, and platelets, which have clotting factors that help blood clot. Altogether, this makes up blood, suspended in the plasma. Blood vessels, again, arteries, capillaries, and veins. Smooth muscle controls the size of blood vessels. Arteriole are the smallest kind of arteries. Venules are the smallest kind of veins. Capillaries are small blood vessels where gases, nutrients, and waste is exchanged between the cells and the bloodstream. And that is a quick overview of the circulatory system.